Welcome to Tonic Tips. My name is Tanya Juge and I'm coming to you live on Facebook and on Instagram. Last week we spoke about fascia and the importance of maintaining your fascial balance and seeing someone to release any possible restrictions that could be inhibiting your ability to contract your muscles. This week we're going to speak about a balanced routine and making sure that your current exercise addresses everything on your body and has equal proportions of exercises throughout. So why is it important to have a balanced routine and what does it mean? Having a balanced routine means that you work muscles on all sides of your body. So you want, if we take a look at the skeleton here, you want to make sure that your routine includes contracting muscles in the front and in the back and in the sides. And this is usually known as antagonistic muscle groups or opposing muscle groups. Typically you see it referred to as the bicep and the tricep. So particularly with the back and the core, it's really important to have an equal number of exercises that contract the front muscles versus the muscles in the back. Very often that is the key that takes someone out of pain. They'll come to me as a patient and the muscles in front, they're doing like 10 exercises for their abdominals and crunches and things like that, but they have maybe one exercise for their extensors. So it's really important for you to maybe sit down with your routine, jot it down, and just notice how many exercises are happening where you actually are flexing. If this is the front of the body and this is the back of the body, you want to have roughly an equal number of exercises where you're flexing as well as extending so that you're creating a balance between the front and the back of your body. It should also include, of course, exercises in abduction and diagonal planes of motion. But one quick way just to assess what you're currently doing is just to take a look at the front motion or the fetal motion type exercises and the extension or the back extension type exercises. Now, given any kind of diagnosis that you have any kind of a stenosis diagnosis or a spondylo, you're going to have to be very careful about any type of extension exercise. That's where it's important to make sure that if you're having any symptoms or any pain that you see a professional who can analyze that. In those cases, it may be necessary to have a biased routine that includes either more flexion or more curling type exercises and a routine that includes more extension type exercises, possibly. So be careful and remember that this is not medical advice. This is generalized information so that you can assess your current routine and maybe make some changes to help balance out your body so you can stay strong and mobile as you age and you can feel good and do all the things that you would like to do. Another point of consideration is how you spend your daily time. Do you spend your daily time 8 hours a day in a sitting position where you're bent over like this for 10 hours a day or 50 hours a week? Guess what? Generally, if you're like this all day, you're going to probably need more extension type exercises. Again, barring any sort of diagnosis that would make that contraindicated. So take a look at your postures, and if you have a job where you stand all day, it's possible you may need more flexion type exercises in your routine. I hope that helps and get you on your way to a stronger, more mobile, agile body. Okay, this is Tanya Juge with Tonic Physical Therapy coming to you live on Facebook in September, Wednesdays in September. I'll see you next week and we'll discuss another important topic in keeping your body healthy and strong. Please leave your comments below because I'd love to answer your questions and any concerns that you may have. I will see you next week and have a good week. Thank you.